In this video, we will discuss about the diuretics. Diuretics are the agents which results in the increased inflow of the urine formation and excretion. This is by preventing the reabsorption of the sodium ion and water from the tubule to the blood. Thereby, that results in the increased amount of water and sodium ions into the tubules only, and finally, excretion of the urine from the collecting duct. These drugs are used whenever animal is having problem with renal system and it is having difficulties in excretion of the urine, and these diuretics play a major role in the congestive heart failure. These are classified as directly acting and indirectly acting, and these are also classified based on their efficacy. Now let us come to the classification of these diuretics. Directly acting diuretics are again classified as loop diuretics, the drugs which act on distal convoluted tubule, and the drugs which acts on collecting duct. This classification is based on the site of action of this drug. The loop diuretics are also called as high efficacy drugs. The drugs which act on the distal convoluted tubules are also called as moderately efficacy drugs, and the drugs which act on collecting duct are also called as low efficacy drugs. Examples for these loop diuretics are furosemide and ethacrenic acid. And examples for the drugs which act on the distal convoluted tubule are thiazides and chlorothiazides. And the drugs which act on the collecting ducts are again classified as osmotic diuretics such as mannitol glycerin, potassium sparing diuretics such as amiloride and spironolactone, and carbonic anhydrase inhibitors such as acetazolamide and metazolamide. And miscellaneous class of drugs which contain acidifying alkalizing drugs. Examples for the acidifying diuretics are ammonium chloride, sodium chloride, and for the alkalizing salts are potassium citrate. And in the miscellaneous, one more category of drug is methyl xanthines or xanthine derivatives. Example for these are theophylline and aminophylline and also caffeine. Now let us come to the mechanism of action of the loop diuretics. This is important from the examination point of view. In nutshell, these loop diuretics act by binding sodium potassium 2 chloride symport. This symport is present on the thick ascending loop of Henle. Before going to the exact mechanism, if we are thorough with the normal physiology which is undergoing in the body, then it is easy for us to understand the mechanism of action of these loop diuretics. Now let us look at this diagram. This is the loop of Henle, and this is the thick segment of the loop of Henle, which is ascending part. And this is the epithelial cell of the tubule. And in the apical surface of the epithelial cell of the tubule, which contain sodium potassium 2 chloride symport. And on the basolateral membrane of these epithelial cells contain a chloride channel and sodium potassium ATPase pump. This is sodium potassium 2 chloride symport on the apical membrane of the epithelial cell, and on the basolateral membrane there is a chloride channel for the exchange of the chloride ions and sodium potassium ATPase pump for the exchange of the sodium and potassium. And this space is the interstitium, and this is the collecting duct. And the function of this sodium potassium 2 chloride is it will transport chloride ions, potassium ions, sodium ions into the epithelial cell. On the basolateral membrane of these epithelial cells, there is a chloride channel which transport these chloride ions into the interstitium, that is medullary interstitium. And this sodium potassium ATPase pump will transport the sodium ions into the interstitium. These ions results in the increased osmolarity of the interstitium as compared to the hypoosmolar in the collecting duct. Because of this condition, the solvent which is present in the collecting duct, in this case that is water, that will move from the region of low solute concentration to the high solute concentration. This high solute concentration is because of these chloride and sodium ions in the medullary interstitium. This leads to the increased osmolarity condition. This is the normal physiology that is going in the body. Now, whenever we introduce the loop diuretics, these loop diuretics will bind to the sodium potassium 2 chloride pump. By binding this pump, that will lead to the decreased movement of these chloride ions and sodium ions into the interstitium. That is nothing but decreased reabsorption of the sodium ions. Because of this, there is no increased osmolarity in the interstitium, and thereby there is no movement of solvent from the collecting duct to the interstitium, that is nothing but into the blood vessels. Thereby accumulation of the water and sodium ion into the collecting duct, that will finally lead to the increased inflow of urine formation and excretion of the urine. This is the mechanism of action of the loop diuretics. Now let us come to the mechanism of action of the other category drugs. Drugs which are acting on the distal convoluted tubule, these are also called as moderately efficacy drugs. Examples for these categories are thiazides and chlorothiazides. These are act by inhibiting the sodium chloride cotransport. This cotransport is present on the distal convoluted tubule, that is DCT of the nephron. Here you can clearly appreciate this is the sodium chloride cotransport. By inhibiting this cotransport which is present on the DCT of the nephron, there is no reabsorption of the sodium ions. This will help in the diuresis. Now let us come to the drugs which are acting on the collecting duct. These are also called as low efficacy drugs, and these are further classified as osmotic diuretics. Examples mannitol and glycerin. These are act by inhibiting the passive reabsorption of water from the tubule. And potassium sparing diuretics. Examples are amiloride and spironolactone. These drugs act by inhibiting the aldosterone receptor. These are nothing but aldosterone receptor antagonists. Spironolactone is the one such example for the aldosterone receptor antagonist. The point which we have to understand is that aldosterone is antidiuretic, which is secreted from the adrenal cortex, and the function of this aldosterone is sodium reabsorption. By inhibiting this aldosterone, we can reduce the reabsorption of the sodium from the tubule, that will aid in the diuresis. And the one important point which we have should note that the amiloride and spironolactone drugs are called as potassium sparing diuretics. This is because these diuretics will inhibit the reabsorption of the sodium ions without losing the potassium, which mean inhibition of the reabsorption of the sodium ions will lead to the buildup of the sodium ion concentration in the lumen itself without affecting the loss of potassium ions. These potassium ions are present in the epithelial cells of the tubules only. That is, potassium sparing diuretics act by inhibiting the reabsorption of the sodium ions. At the distal segment, they interfere with the sodium reabsorption, that is, that increase the sodium excretion without potassium loss. Now let us come to the miscellaneous class of drugs. These are again classified as acidifying or alkalizing salts. In acidifying diuretics, examples are ammonium chloride and sodium chloride. And for alkalizing salts, examples is potassium citrate. And the next class in the miscellaneous is methyl xanthines or xanthine derivatives. Examples for these are thiophyllene. These are act by the increasing the cardiac output. This cardiac output is increased because of the positive inotropic effect of the heart, and that positive inotropic effect is because increased amount of cyclic AMP in the system. Whenever we introduce the theophylline, this theophylline will bind to the phosphodiesterase 3, and this phosphodiesterase 3 will convert the cyclic AMP to the 5-AMP, thereby reducing the concentration of the cyclic AMP in the system. Whenever this theophylline is introduced in the body, this drug will bind to the phosphodiesterase and by helps in the retaining of the cyclic AMP concentration in the system. That will helps in the increased cardiac output by aiding the positive inotropic effect by the heart. And some more points we should know in this topic is the antidiuretic hormone, that is also called as vasopressin. This is secreted from the posterior pituitary, and this is act as the reabsorption of water in the renal tubule. By inhibiting these vasopressin or antidiuretic hormone, we can reduce the reabsorption of the water in the tubule, thereby increased amount of water retains in the collecting duct only, and finally that will helps in the increased flow of urine and excretion of the urine. This is about the topic diuretics. In the next video we will discuss ecbolics and tocolites. Thank you.